Going to follow Mayo Clinic's consolidations between its Albert Lea and Austin campuses.
Many inpatient services have already moved to Austin, and on Tuesday, Freeborn County commissioners met to talk about writing a letter to Mayo leaders about how the changes impact older residents within the community.
KIMT News 3's Jeremiah Wilcox was at the meeting and has more for us this morning.
County commissioners are still confused about the future of Mayo here in Albert Lea, and they were left with more questions than answers. Inside the Freeborn County Government Center, questions are still unanswered, and Tuesday County commissioners met to continue its talks as Mayo Clinic continues to move services from Albert Lea to its Austin campus.
We're trying to communicate in how some of the services are leaving and what the future will hold.
Christopher Schaff is the board's chairman. He says the moves put the elderly at risk, which is the board's reason for drafting a letter to Mayo Clinic leaders. We wanted to know what the community impacted by this thinks, and they were more than eager to share their side of the story. Jan Matson lives in Albert Lea and is concerned about the way the city is changing.
Kind of in shock, and so I became active in the Save Our Hospital group.
She says board members aren't taking into account what's best for the community.
I've heard of people that got over to Austin, found they couldn't see the doctor there, they had to be taken to Owatonna and sometimes over to Mankato or to Rochester. Who's paying for all this? We are.
And that's one of the concerns the board wants Mayo decision makers to address. It wants to hear it straight from the top on how this is going to play out for its residents. And commissioners are hoping they will get some clarification in the next 30 days. Reporting in Albert Lea, Jeremiah Wilcox, KIMT News 3.
So we did reach out to Mayo Clinic about this proposed letter, and they did respond in a statement saying, of course, they have yet to receive this letter since it's just being proposed by county commissioners. But it goes on to say that they look forward to the continued dialogue with community members about the best approach to keep access to health care for Albert Lea and Freeborn County residents.
This move in Albert Lea comes as Mayo Clinic looks to add to downtown Rochester skyline. Mayo announced Tuesday an 11-story addition to its current Gonda building, making it the tallest one in the Med City. It will expand clinical space and include a hotel to meet patient demands and needs. Officials say the extra space will be part of the cancer and outpatient procedure centers. Construction is expected to start in late 2019 or early 2020. Still ahead, the future of an important library could be in jeopardy.